Welcome, and thank you for joining us for our live virtual MDA Engaged Community Education Seminar, where we are highlighting specialists in the Midwest today. My name is Nicole Petrowski, and I am the Community Education Specialist for MDA. We appreciate you joining us virtually and are glad to be able to share this important information with all of you. MDA is committed to community education, and we believe in the power of bringing our community together for opportunities to have people learn more. MDA Engage series has two specific topics. We have disease symposia, specific and community education seminars, as well as community webinars. As you can see here, our community education seminars that we are having today are geared towards general neuromuscular topics. While each event will feature regional specialists covering these topics, each event will also feature a specialty topic, which you can view on your screen here. These are some of the events that we have lined up for the remainder of 2020. And then here are our disease-specific symposiums that we have that are geared towards particular diagnoses. And these topics will also include best practices in care, research, and clinical trials, and others. To view these agendas for these seminars and symposiums, as well as to register, you can visit MDA Engage section on mda.org, and you will also find our past recorded events here as well for your viewing option. We would not be able to put on educational programs without support of our generous sponsors. I would like to thank Numotion Foundation, Biogen, and Genentech for supporting this seminar. I would also like to thank their representatives who are in attendance today. Now, I have just a few housekeeping items to go over before we begin today. We are recording today's event, and we will be posting it to mda.org website for on-demand viewing in a few weeks to ensure that those who weren't able to join us live today will be able to view that. Also, all phone lines have been muted. We will be having Q&A session at the end of each presentation. So if you utilize the Q&A icon on the bottom or top of your screen, depending on where it may be, just simply type in your questions, and you can type those in as they come up. You don't have to wait till the end of the presentation to do so. If you also, we encourage participants to communicate with each other by utilizing the chat feature throughout the day. If you want to just say hi or let someone know where you're from, or you want to propose a comment out there to whoever is listening, simply click on all panelists and attendees. Attendees is important, that way everyone on who's listening can also receive your comment. So feel free to use that throughout the day. And you will notice on the agenda, there are small breaks between speakers. So feel free to stay connected during that time. That's the time when I'm going to make sure our next presenter's technology is working. So you will hear us on the microphone, just so you do know that, and I know that. And then finally, we will be sending out a brief survey afterwards, and we would like to receive your feedback on what you heard today. We want to make sure that we're discussing topics that are of interest, and we use your feedback as a way to improve future education events. So thank you in advance for taking 5 to 10 minutes to fill that out. And with those details out of the way, I am pleased to introduce to you Dr. Cuixia Tian, who is an assistant professor at Cincinnati Children's Hospital since 2014. And she is currently the director of the MDA Clinic, director of PPMD Clinic, and co-director of the Multidisciplinary Comprehensive Neuromuscular Care Center at Cincinnati Children's Hospital. So Dr. Tian, thank you for being here today, and I will turn the presentation over to you.
Thank you so much, Nicole, for the introduction. And thanks everybody and for this opportunity. And I want to thank Muscular Dystrophy Association to give me the opportunity to present to you today. And hopefully you'll find my presentation today is helpful and informative. And feel free to ask questions. I would be happy to answer to the end of the presentation. So today I'm going to talk about best practices in clinical care.
Can you share your screen?
Yeah. Mm-hmm.
I know there's a delay, so I just didn't know if you were. Perfect.
Can you see it?
I can, that's great, thank you.
Perfect. Yeah. So today's topic is focused on caregivers, which I think is a very important topic. And there are areas of caregivers participation in our care teams. And we always need to think about it. And it's a major part of a medical decision-making team. And I want to touch base with you and see what from a medical professional's perspective, and to help you and facing some of the challenges, and hopefully have a good ways to cope with it. I want to start by introducing our hospital. Cincinnati Children's Hospital is one of the leaders in providing pediatric patient care. And I have been working at Cincinnati Children's since 2009. And I did my residency with pediatrics and neurology there, also my neuromuscular fellowship training. And the top picture is a bird view of the Burnett campus, which is the main campus of our children's hospital. The light brown buildings in the front are the clinical buildings, and the blue building to the left is the research building, and where the clinical research, basic research happening. The lower picture is our research clinic waiting area. It's a beautiful hospital. I'm very proud to be able to work in this hospital. I want to start with my disclosure. I'm a principal investigator for several clinical trials sponsored by industrial pharmaceutical companies to find a cure for neuromuscular diseases. And I'm also an investigator for National Institution of Health funded research as well. And outline of my talk today, I want to give an overview of what the responsibilities our patient families, caregivers have, and what's the challenges they're facing. And I want to touch on the things that's very important for families, caregivers to know, to be able to take care of your loved ones. And then I want to also emphasize how important it is to care for yourself as caregivers of our team. And also I want to overview the resources that can be helpful for you. So what are caregivers? If you are caring for a family member or friends with a medical condition, you are a medical caregiver. However, your medical caregiving is not just restricted to the medical needs. You still need to take care of every aspect of the daily task of your loved ones. So from prepping the meals, bathing, transportation, doing the cleaning, shopping, paying all the bills, to medication administrations, to bring them to the appointment, to give them emotional support, and to take care of all their medical care needs, organize all the activities around it, also make medical decisions with them. You can tell this is a very broad spectrum of responsibilities you have. And if you are participating in any aspect of this task, you are a caregiver. You don't have to do all of them, but even if part of it, you are a caregiver. And we recognize your effort and your dedication to the medical needs of your loved ones. So what are the challenges? So especially for our neuromuscular patients, there's significant disease burdens that come with the disease, and there's significant emotional stress. And because all that, and made them to have very complicated medical needs. And this led to a lot of difficulties in deliver the medical care and get your loved ones to meet the doctors, and you need transportation. And there are disease affecting communication skills of our patients. So there's another barrier for that too. And they're very complicated medical visits because the disease impacts not just the muscle, not just the nerve, it impacts many different systems of our body. So it has very complicated medical management plans, and there are many specialties involved. And one another addition to our populations, we are in a very exciting area with new therapies and research opportunities And to learn about that and keep update about those is another layer of challenges for our family. So I always want to look at things in a positive way, and facing all these challenges, I want to always remember to look at the bright side of caregiving, and there's rewarding of caregiving, and by the act of caregiving, people do benefit actually physically and emotionally, and the caregivers, many studies actually have shown having better physical and mental health and live longer. And this is believed by the positive emotions and overall sense of well-being affecting the life satisfaction perceptions and their ability to cope with stress. This leads to increased longevity, and actually they observe faster recovery from diseases and when that happens to our caregivers. And therefore, inviting others to share the care actually give others a strong emotional boost. Okay. So another part of rewarding of caregiving is involving children. Actually, children are capable caregivers, and they can learn by giving care, learn compassion, cooperation, patience, and responsibilities. However, I do want to point out, and children are not supposed to take a primary responsibility for caregiving. And their studies have shown teens who take primary responsibility for caregiving can impact their psychosocial, emotional health and can have depression, anxiety issues, and make negative impact for them. So we should try all the best to prevent that from happening, although we know it's a very rare situation. So what are the things we need to know to help our loved ones who has a neuromuscular disease? I think those are the key things we need to remember. First is what the disease is, and knowing as much as possible about the disease is very helpful. And second, know the medical team who is involved in taking care of our loved ones. Then know the medications they are taking. And when there's a clinic visit come up, and know how to prepare for it. And a very important aspect of the care is have an emergency care plans. Know what you should do when emergency happens, and what your loved ones really want for those situations. So first, know the disease, because knowing about the neuromuscular disease your loved one have can help determine whether this symptom is related to the disease as expected or not. If it's not, there should be more medical care to be delivered, and then there's medical attention to be seen. And plan ahead of time to make arrangement and adjustment accordingly. And you know the disease progression, you know the impact of life, and you can plan ahead of time to make it easier when that happens. Of course, when there's doubt, always call your neuromuscular team, and that's where you can find information that's specific for your loved one to help you make medical decisions. So know the medical team. Here, I really want to emphasize the importance of have a primary care physician, which is a doctor actually not specialized in the neuromuscular disease, but they know every other disease is out there. So as a neuromuscular patient, we do have a risk for other medical disease as well. So it's still very important to have a primary care physician and have regular medical checkup with your primary care physician. Getting all the vaccinations you need, especially flu shots and pneumonia vaccinations. Those are very essential for our populations to prevent respiratory complications that can happen. And medical conditions of chronic illness like diabetes, cancer, hypertension, heart diseases, all those can add extra layers of medications and treatment, and always can impact what medication or treatment a person can take because of those chronic conditions. So your primary care doctor can keep your neuromuscular doctor informed about all those. And When it comes to the neuromuscular specialist, yeah, we are talking about the multidisciplinary part, right? Because it's not just a skeletal muscle disease, it impacts a lot of systems of our body. That's why your multidisciplinary neuromuscular specialists have a lot of specialists in it. The neurology, cardiology, pulmonary, gastroenterologist, rehab medicine, nutrition, physical therapy, genetics, orthopedics, and the psychologist. This is not actually a complete list that may involve in your loved one's care. And those are the main key players in the team. I do want to go into a little bit further detail to explain what the specialties really do to help you, to help understand the medical team's complexity and help you to communicate. So neurologist is a key provider for a neuromuscular team. And this is a doctor knows about neuromuscular disease and really can coordinate care for you. And we consider the neurologist as a quarterback in this care team. And neurologist is also in charge of prescribing medications that's disease specific. And in the past 3 years, in our pediatric neuromuscular field, it has been very exciting improvement and exciting of development of new drugs. And for those disease targeting drugs, and those are prescribed mostly by our neurologists, okay? And cardiologists are the ones who's taking care of your heart, because heart is muscle, is affected by nerve and muscle diseases. It's very important to see if there's a risk of heart disease with your loved ones. If there is, cardiologist is one definitely should be included in your care. And cardiologists can do regular testing to monitor the cardiac function, cardiac rhythm, and they can prescribe medications to treat the cardiac aspects of the disease. Pulmonary doctor is a doctor taking care of your breathing. So your airways, the lungs, any illness that come from it, chronic complications with weakness, and they can support oxygenation and support good sleep. So pulmonary doctor is the one taking care of the breathing and the sleep concerns with it. And gastroenterologist is a GI doctor and is a doctor taking care of the feeding tubes and taking care of the swallow functions, taking care of any of the constipations that may be related to your neuromuscular diseases. And this is a very important specialty for our medical care of our patients. And rehab medicine doctor is the one to help you to address all the equipment needs, and wheelchairs, lifts, to make sure you have ramps to ensure your access to different areas at home and outside, to make your loved ones very functional in terms of engagement with the community, to keep them more independent as possible. Nutritionist is very important as well, and they can help you to analyze the intake of nutrients for your loved ones. A lot of our neuromuscular patients has feeding issues and they rely on supplements of nutrition, some on the tube feedings. Nutritionist is a critical part of to ensure the energy and the proteins that your loved one have. Another aspect I want to see is about bone health, because neuromuscular disease, we do have weakness, and then there's a prone for osteoporosis, which is a risk to having fractures and have significant impairment if that happens. And the nutrients to target on calcium intake and the vitamin D intake is very important. That's part of what the dietitian can help you with. Physical therapists are the ones to help your loved ones to have efficient and non-harmful exercises. Keep them fit, keep them maintain their function, or even improving some of the functions, depends on patient stage. And they can ensure the joint range of motion to make sure the loved ones in the best condition physically as possible. And genetics is a key part of our pediatric neuromuscular clinic, I think is becoming more and more important on the adult side as well, because a lot of neuromuscular disease are related with genetic changes. So consult for what's the genetic underlying cause for the disease, and counseling for the future, and family planning, and either siblings or offsprings of our loved ones is very important. Genetic counselors and geneticists are the important part of our team as well. So orthopedics are the doctor taking care of your bones. Our neuromuscular patients tend to have high risk for scoliosis, which form a curve on the spine. Some are so severe, can impact the breathing function, the heart function as well. So some patients may need to have surgery to make their spine straight to help the function of the internal organs. And also their contractures can be built up because of neuromuscular weakness, and can cause pain and can cause a lot of dysfunctioning with it. And that's when the orthopedic doctor can come in to help to offer surgical options to manage that complications. And the psychologist is so important for our care, for emotional stress, for better understanding one's needs, and what's out there with the disease progression, and what's out there with the world, how to interact, and help with disease coping. And the psychologist is a very well recognized asset for our neuromuscular care team. So I think this is a picture of our neuromuscular team at Cincinnati Children's, and it has our medical assistant, nurses, nurse practitioners, our program coordinator, and all our specialists from different specialties. Here we have our cardiologist, pulmonary doctor, our rehab medicine doctor, and our physical therapist, of course, our neurologist as well. And we also have endocrine doctor in our team as well. And it takes a village, and it's very important for our team to keep communication. We see patients together the same day. We communicate with each other, and we come up with a well thought through multidisciplinary care plans for our family. And we offer good collaborations and cooperations in medical decision making with family. So before you go to a clinic visit, and how to prepare for it is very important. And make a clinic visit planner and list relevant histories, symptoms, and specific questions. And that's important. And that way can help you keep organized, keep track if your concerns can be answered, and knowing the symptoms that are life-threatening, severe, disabling, or is there something really concerning for you too? And pay particular attention to the breathing issues and heart function. That's what respiratory and cardiac symptoms. So during the visit, feel free to ask questions, because we want to understand and what's going on with our loved ones. What's the specialist overall assessment, how our loved ones are doing, and what's the outcomes of disease, what we can see from here, whether the disease is progressing, and what are the treatment options out there? Are there treatment options targeted for this disease? Are there new drugs coming up? And are there supportive treatment if there's no disease, modifying medications? And what can the doctor recommend down the way? And are there any changes we need to change? And anything we need to be prepared for? And next, I want to emphasize, review the list of risks your loved one have, because neuromuscular diseases are prone for some of the risks which could be life-threatening. For example, for our patients with Duchenne muscular dystrophy, and for our patients with RRR1-related congenital myopathies, we have highly increased risk for malignant hyperthermia, which is a complication with anesthesia drugs. It's very important for them to have recommendations about a risk for anesthesia to communicate with all the care specialties, especially when elective or emergency surgery is happening, when sedation anesthesia is needed. And their patient population have higher fall risks and a higher risk for bone fractures, and they need to be addressed, and they need to be aware and to prevent that from happening. And for patients on long-term steroids, for example, for our pediatric patients with Duchenne muscular dystrophy, and they are adrenal deficient, which means they could not produce stress hormones as efficient as others when they are on long-term steroid treatment. So when there are severe injuries or infections happening, it's very difficult for them to mount a successful stress hormone reactions to fight the disease. And that should be kept in mind when they need an IV dose of steroids to keep them to fight the disease. And it's very well known for some of our muscle patients are increased risk for rhabdomyolysis. It's for muscle breaking down. And to have particular measures and to prevent muscle breakdown for those patients is very important. And the last but not least, I want to see in your clinical visit, make sure you ask for questions about clinical research updates and opportunities for our loved ones, if there's any. And I think it's worth to read about it. And sometimes if you are interested, to explore further. And there are potential benefits come with clinical research, but always proceed that with precautions, because it's still research-based. It's not a true therapy. But it's always good to know what's there in the future. So next topic I want to touch base is what's the emergency medical care plans. It's so important to understand what you should do during the medical emergency. And you try to collect all the important medical information in one spot and keep this information current and post a copy in the refrigerator as well. When ambulance crew they have been trained to look in the emergency is on the refrigerator if that's a copy of emergency plan. Also, with the technology of today, and it's important to keep a photocopy on your smartphones and computers to keep that handy as well. And what should be in this? And you need to have your name, birth date, diagnosis of your loved ones, and specific baseline information to let the emergency care people know immediately what are the things they need to pay attention to. Your loved one couldn't speak, couldn't move legs, and they need BiPAP, which is a ventilator support. It's an important device to save lives when emergency happens. And if they have a chronic heart condition that has heart failure, they really impact what medication the emergency care people should choose. And that way they don't overload our patient with fluid and cause medical complications with that. Always wise to have emergency numbers for contact, and also insurance information, number of their doctors and their phone numbers, list of medications, the time and dose, and what's the adaptive equipment your loved one should have, and what are the allergies, and what are the special diets they are taking. And one of the very important component of this should have is advanced directives and living wills. Understand what your loved ones really want is so important in emergency situations, especially if they do not want resuscitation, which means they don't want chest compressions, they don't want cardiac conversions, and those are the things need to be specified in the emergency care plan. And in the emergency care plan, the emergency service people know how to do it, make the wishes of your loved ones to become a reality. Okay. Also important to have a history of surgeries and major medical events, and in this plan, and your emergency care team will understand and know the risk and know what to do accordingly. So with all the medical needs our loved one has that bring a lot of burden to our caregivers, we recognize the emotional demand, the physical demand. Also, besides the medical needs of your loved ones, you have other family responsibilities as well. You have your job responsibility as well. Some do not stay home all the time. Some people really have a job as well. So I want to see, this can give a significant toll on our lives. Even the strongest and most devoted caregivers cannot do it alone. So I want to review some of the caregiving tips for our families, and it's important to get support from others. So others, including other caregivers who can be very supportive for you to learn the tips they have, the experiences they have. And always keep in mind, you need to take care of yourself as well. And do not hesitate to take up on offers of help and communicate with your doctors promptly and efficiently. And take breaks often, as much as possible, to take time for yourself. Also watch out for yourself for any signs of depression, and take up advantages of new technologies, can make life simpler and easier, and organize all the medical information and legal documents, and it can be really, really helpful. So last, to give yourself credit for doing the best you can. This is one of the toughest jobs there is caregiving. So main point for caregivers is get help early. Get it from every possible sources and accept all offers. And there are caregiver professionals, and they're called home health services, also home care services. Those are potential state support for those. And for Medicaid programs, the waiver program particularly allows for coverage for chronic ill patients to get home care services and home health services. The home health services is more medical related, and it is our typically RNs, registered nurse, to take that responsibility. However, home care service, it doesn't have to be a medical people, and it can be related with other responsibilities you have, but that can lend a hand to you and make you focus on what the things you need to do for your loved ones and give you a break. So it's very important to consider those aspects as well. And hiring a professional can go through agencies. Sometimes it can also go directly and by yourself. And I also see some of the patients' families are very successful, utilize the therapist in training, and because it's saving on the cost, and they have a long relationships with therapist students, can be very helpful for the family needs as well. So don't forget about volunteers and recruiting volunteers as much as they can. Because there are many ways actually others can help. Your friends, your neighbors, your church friends, your co-workers, and social acquaintances, and family members. And whoever offers to help takes their offers. And people actually typically help more if they should receive specific instructions. So design the task for them is a very efficient way to do it. As we remember, caregiving actually is rewarding. So it draws friends, families close together, actually makes everyone feel needed. And it gives the primary caregivers some break and make it easier to keep a loved one at home, and delaying or avoiding the placement in the long-term care facilities. So I think have a chart is very helpful to list the people who offer to help, and all those who might be waiting if asked. Develop a chore list and match the chores with available people, And don't forget, and children can be good helpers for some of the tasks as well. It can be just walk your dog, stay with your loved ones and call you if there anything happens as need. So while taking care of our loved ones with physical disadvantages, we want to keep in mind of fostering their independence, because independence really fuels a fighting spirit. You can help your loved one maintain the highest possible degrees of independence, and it's a strategy we need to change with the disease progression as well. Give them confidence and let them feel the freedom. So the key things to fostering independence in our loved ones is to be patient, allow them to take time, and to be collaborative. So ask what they want before you offer a helping hand, and let your loved ones use your hands, not your brain. That'll be the best way to accomplish what your loved ones want. And help set up technologies for your loved ones. And with the advancement in technology, you'll be amazed how much your loved one can do with technology. And always consider use adaptive devices and strategies to help. So this is overview of the resources we have, and their state waiver respite programs can offer help to give our caregivers courage and a break. And their supporting groups also offer helping hands. And social worker in our clinic is a big part of our care as well. And they have good resources, can guide you the right way. And your county health services, state social services. And I want to mention our Muscular Dystrophy Association has a great resource center, and they have direct numbers, and then you can talk to the staff working there to give you resource support as well. And these are two resources I found is extremely helpful. One on the left is the link for our guide for caregivers, and that's made by Neuromuscular Dystrophy Association. On the right is a book that's written by Visiting Nurse American Associations for Caregivers Handbook. It has great information for caregivers' own mental health and physical health. A lot of tips how to take care of our loved ones. So I want to thank you, and I want to see, and you are doing a great job at taking care of your loved ones. And do not do this alone. And I admire you for put every day and dedicated to the care of our patients in need. Thank you very much.
Thank you, Dr. Tian. That was great. I just have one question that had come in. How do you go about getting set up for home health? Is that something that you need to start with your insurance company, or does your doctor start that process for you?
I think it is from both sides, and the insurance coverage is something is very important to explore. Mm-hmm. And the doctors can give prescriptions, give orders for what health care you need at home based on your loved one's condition. And our social worker are very helpful to draft letters, and we can send the medical support evidence.
Okay.
Mm-hmm.
And is a CPAP or a BiPAP better? What's the difference between those two?
CPAP and BiPAP, the difference is the pressure it gives during the breathing phase. So the CPAP is a constant pressure during both inhale and exhale phase. And it's a positive pressure which keep your lungs expand. And that's more suitable for the patient do not have weakness on their respiratory muscles. I think that's the key thing for that. For the BiPAP, And it gives a pressure to help you to inhale, and it also gives you a pressure when you exhale. And it's one of the best non-invasive ventilation device for patients with weakness on the breathing muscles. So,
all right, perfect. Thank you.
You're welcome.
I'm not seeing any other questions pop in. I believe that might be it. If we get anything else, I can certainly let you know. But thank you very much for being here.
You're
Have
welcome.
a great rest of your Saturday.
You too. Thank you so much.
And up next, we are going to hear about genetics and genetic testing. And so just a reminder, we are recording this seminar and it will be able for playback in a couple weeks. And feel free to chat with others through the chat feature, and then we will be right back at the top of the hour. Thank you.